Welcome everyone to this Demos 2030 Public Services Network event. My name's Ben Glover. I'm the head of social policy and I will be chairing the discussion today. Thanks to everyone for joining very promptly. The Demos Public Services 2030 Network is a monthly event space where we get together sometimes at our offices in 15 Whitehall, sometimes online like today, and we showcase innovative thinking and practice from across the country with respect to running public services. I'm delighted that we are discussing today a new Demos essay, which we have just launched this morning. So it's hot off the press, as they say. This essay is called The Motivational State, a strengths-based approach to improving public sector productivity. And you are all about to hear much more about this from the authors of this brilliant report, Alex Fox and Chris Fox. Alex is delivery director at Empower Consulting, where he leads work to transform adult social care. Alex developed the asset-based area model, chaired a government review of charities, and also wrote a new health and care system, Escaping the Invisible Asylum. He's joined by his co-author, Chris Fox. Chris is Professor of Evaluation and Policy Analysis at Manchester Metropolitan University, where he's Director of the Policy Evaluation and Research Unit and co-lead of Metropolis. I'm delighted that we're also joined by Thea Stein. Thea is the Chief Executive of the Nuffield Trust and has written extensively about public sector productivity. Thea was previously Chief Executive at Leeds Community Healthcare NHS Trust, and before then Chief Executive of Carers Trust, Yorkshire Forward, and North East Leeds Primary Care Trust. Some great speakers today, and also a really great group of people on the call. Can see from all the attendees that have joined, we've got a really great group here to discuss these issues. So without further ado, I will hand over to Alex and Chris, who are going to take us through a few slides and their kind of argument of their paper about why we need to think about public sector productivity differently. We'll then go to Thea for some response remarks. I will abuse my position as chair and put a couple of questions to the panel. And then we will open it up, and we've got a good amount of time. We finished at 1:15, so we'll have quite a good amount of time for discussion. Please use the Q&A function if you'd like to ask a question. I think you can kind of vote on other questions if you want to sort of bump it up the list, and I will go through them and put them to the panel. So without further ado, over to Alex and Chris. Thank you so much.
Great, thanks Ben, and thanks so much for hosting this and for supporting the essay that we've written. So I'm going to start off, and I'm really going to try and set the scene for why we need to be thinking more about public sector productivity, what some of the challenges are, and really sort of setting up our central proposition, which is that the motivational state, a strengths-based approach, is a good way forward. And then Alex is going to come in and talk in a bit more detail about what that would look like, and draw on some practical experience to set out some really sort of tangible ways in which we can take that forward. So public sector productivity, obviously a key issue for the current government, a key issue though, of course, for successive governments, because public sector productivity has been very low, or growth has been very modest for a long time now. And so this has been a long-term issue for successive governments. The challenge we have partly here is, of course, not only that if we have low public sector productivity and limited financial settlements for services, we have limited opportunities to do more. But of course, also actually public sector productivity is part of overall GDP. So it also has an impact on national GDP as well. It makes up about 20% of GDP nationally. So there's multiple reasons why we need to be sort of thinking about this. So if we kind of move on, the challenge we've got is that when we think about productivity, we start really from a lens that was developed for thinking about productivity in essentially the private sector, not the public sector. So we think about the idea of um, uh, activities and outcomes, and the people that can deliver those. But the problem, of course, we have is that that kind of model doesn't always work quite so in such a straightforward way in the public sector. So in the public sector, we have a range of inputs going into our thinking on public service productivity. But a lot of those inputs are around people. A lot of the activity that is produced is not in and of itself going to be sufficient to create a productive public sector. What we've got to do is to achieve great outcomes. And one of the challenges we have in the public sector when we think about productivity is that value is not always straightforward. In the private sector, if a factory manages to produce more widgets with the same resource going in, it's generally increasing productivity, and the market will then decide on the quality of that work, because if the widgets are of good quality with and quality isn't being affected, the market will allow those widgets to be sold for the same price or even a higher price. But of course, we don't have that option in public sector thinking to always easily understand what the value is of the things that we're producing. So if we move on, Alex, the ONS has a methodology that's developed for calculating public sector productivity. And in some areas, it tries to adjust for the quality of what is being produced. So in, say, adult social care, there is a mechanism for adjusting for quality. But in some areas, that mechanism isn't there. So, for instance, in some areas of justice, there isn't an easy way to think about the quality alongside the inputs and the outputs. So in other words, our understanding of productivity is really quite limited at the moment. So we have a problem straight away, which is that this is a difficult thing to measure, difficult thing to conceptualize in public service terms. However, we have tried over the years to do lots of things around public service productivity, and we detail some of these in the essay in a bit more detail. But we kind of group them into four broad approaches that people have tried. So obviously, increasing pay can sometimes improve productivity, but the evidence base for that is pretty limited. There are some studies that say that increases in pay can lead to small increases in productivity, but clearly it's not simply about pay. That isn't in and of itself is not going to solve productivity problems. Thinking about outcomes, there's been a lot of focus over recent years on a stronger focus in public services on outcomes, on creating social outcomes of value. We've had initiatives such as the social impact bond model and various other kinds of social outcomes contracts, and they've had some successes in some places, but the success has not been uniform, and they also raise challenges, and those are fairly well documented, and we cover those briefly in the essay. In the private sector, a big focus on raising productivity would be around management. And a challenge here is that there's a political rhetoric sometimes in the public sector about the value of or the lack of value of management. So investment in management is not always straightforward. That's not only in terms of the numbers of managers we have, which in many parts of our public sector are relatively low compared to other countries, other comparable countries, but also the quality of the management and the kinds of things managers are doing. And then, of course, in the private sector and increasingly in the public sector, there's a big emphasis on the role of tech. Can tech help us improve public sector productivity? And at the moment, much of the emphasis here is on AI, and clearly AI can help us improve productivity in public services. We can have AI diagnosing in medicine, reading x-rays, reading scans. We might have AI running ambulances, driverless cars, etc. There's lots of ways in which AI could influence and be used in public services. But it's not going to be clearly the solution to everything. There's a long way to go yet on AI. We just put this diagram in because we found it quite amusing when we asked ChatGPT to try and help us design a diagram for illustrating public service productivity. This is what it came up with. So it kind of feels there's a way to go yet. So this is definitely part of the solution. We're not Luddites. We recognize the role of technology, but we don't think technology is going to be the be-all and end-all in this debate. If we sort of take a step back, quite a lot of the challenges we've got in this area are that we tend to have a model of public services that is still rooted in the post-war settlement and the idea that services do, to some extent, work a little bit like some private organizations would do, in that they deliver a defined service or intervention for people. They fix particular problems, challenges, issues that people have. And they are limited in their understanding of people's broader holistic needs. And so I guess that's been very manifest in ideas around new public management, an idea that's been very influential in public sector thinking now for many decades, and despite many critiques, continues to have a lot of currency in the sector, tends to rely on the idea of giving people more choice, supporting choice through better information, and improving efficiency through clear targets and better management of processes. That kind of model, which seems to be very closely linked to this deficit-based way of thinking about people and the challenges they have in life, seems to be a real block to rethinking public service productivity. So, is there a different way to do this? Well, lots of people on this call, I'm sure, are very familiar with some of the ideas that are associated with strengths-based approaches to thinking about public services. A model that starts from the idea that people have assets or strengths, that the role of public services is not simply to fix people and the particular issue they might have at a given point in time, but it's to help people build their capabilities, help people to flourish, help people through both using their own resources, but also the resources of people around them, their networks, their communities, etc., to lead more fulfilling lives in the longer term. So draws together ideas of co-production and co-creation, encouraging ways of working with people that are shared, and also drawing on community assets that people might have in the areas that they live in. So there is a kind of an alternative approach here. And over the last sort of 20 years, there have been various manifestations of some of these ideas in some of the thinking, which broadly you might sort of refer to as the relational state or relational public services. So IPPR's report on the relational state from quite a few years ago, some of the work on the role of kindness and emotions in public policy, and then I guess more recently, human learning systems, some of the work being pioneered by Toby Lowe, Rob Wilson, Hannah Heskrews and colleagues, and that model of the human dimension of public services, the need for systems approaches, and the way in which learning has to drive the improvements within those systems. So there's a whole range of ideas here that broadly speaking talk to the idea of a strengths-based approach. But, and this is where I will in a moment hand over to Alex, but we seem to have got so far with these kind of arguments, but then we seem to have stalled. And we think there are really sort of two particular problems. One is from a political perspective. It's quite hard sometimes to articulate what a strengths-based, a relational approach really means, and how it will be different. If you're a politician, this is not an easy concept to sell to the electorate. The Economist recently had an article which I think illustrated some of this, looking at public service reform, looking at some of the ideas, quoted indeed Ben in the article, but did also say that services that are personalised and relational are voguish but vague ideas that have been developed in local government. So there's a challenge here about how we kind of articulate these ideas, how we tell the story, and how we make this politically palatable. And then there's also the challenge, I think, that has very much been an academic challenge, but is also a concern for some people working in the field, which is that these kind of ideas about building people's capabilities, building their sense of flourishing, helping people to lead a good life, are ultimately grounded in neoliberal ideas of individual responsibility. They don't take adequate account of the structural challenges that people face in their lives and the ways in which systems and structures need to change if people are to lead a good life. So there are two big challenges here. One is more of a political one. One is more, if you like, of a sort of conceptual theoretical one, of trying to sort of make sure that if we can develop a strengths-based relational way of understanding public services, and if that can lead to better public service productivity, we have to overcome these challenges at the same time. So at that point, I'm going to hand over to Alex, who's going to outline a little bit more of the thinking we've put in the essay around how we can do that and what it would look like.
Thanks, Chris. And arguably, trying to write about about productivity from a strengths-based perspective kind of leads into that second challenge. Is productivity even really compatible with a strengths-based perspective? And in the second half of the essay, we try and set out why we think it is. And one of the key changes that in thinking that we are talking about is that shift from that very transactional way of thinking about public services, where one set of people, professionals, create value for another set of people that use services, towards a model which is much more relational. So our core argument is that public service reform tends to start from the wrong end. It thinks about governance, about organizational structure. And really, for us, if you look at all of the wicked challenges that face public services, with people going on increasingly long and complex public service journeys, for which there is no off-the-shelf product or intervention that can fix things in any sustainable way, what we're looking at is the need for a different kind of relationship at the heart of our support services. So at the moment, we offer people a succession of brief transactions which are highly boundaried, often quite one way, with a succession of strangers. And that suggests that those strangers, through their skills and their qualifications and their resources, can fix things. But actually, in reality, the value of a public service is in the value of what's created by the relationship that is possible and encouraged when somebody who's looking for support is brought together by a public service with somebody who wants to offer support. And actually, it's not just between those two individuals. There's a whole extra domain of complexity here, because on the service side, particularly as people require more support from more agencies over a longer period of time, it's rare that, and again, thinking particularly about those people for whom public services struggle the most, that a single service is creating the change. It's often lots of services interacting with somebody's life. And then for the individual, most of us don't exist in a vacuum. Most of us are part of households, or want to be part of communities. So actually, you've got a whole network of people who are interacting with that individual as well on the side of the people that are drawing on support. So you've got this real complexity, and traditional service models tend to throw up their hands or to create more and more complex pathways or more and more navigating systems to try and find their way through that. And actually, what we're suggesting is that you can find a not easy, but a simple way through that, which is by defining the behaviours and the relationships that we need to see right across all of our public services. And that starts to address that first challenge that Chris talked about is it's just so vague that it's either not useful or that it's simply a way of smuggling in some sinister neoliberal ideas into what should be relational services. So there are already evidence that we can take the approach that we're outlining. So we talk quite a bit in the paper about adult social care because it's one of the sectors in which, because of the influence of ideas like asset-based community development, personalisation, self-directed support, disability rights, actually some of these ideas are already in evidence and showing signs that they can be scaled. So this rainbow picture comes from Think Local Act Personal, where we gathered together a growing catalogue of approaches that all share those behaviours and those values, right the way from the middle of this diagram, where it's the interface with hospitals and people that require really significant or crisis support, through to the outer rim, which is pretty much everyone, and into that kind of preventative and whole community space. I worked for a long time with the shared life sector, which is a great example of a already scaled public service sector that takes a radically different approach, supporting about 15,000 people right across the UK. The UK is a world leader in this. And in shared lives, people with learning disabilities and other significant support needs visit or move in with their chosen shared life carer, facilitated by a local service, and live as part of the family rather than going, say, to live in a care home. And that's a great example of this kind of different dimension of productivity, where you've got an individual and their family, you've got a shared life carer and their family, you've got the community around them, you're drawing value, and therefore we would argue productivity from many more sources, and to create a service which is formal and paid and scaled. And the inspector CQC always say it's better and safer than everything else. It's also lower cost and better value for money than alternatives. My click is about to start a video, which was not what I was aiming to do there. So let me go on. So we try and draw from those ideas 3 basic principles for boosting public sector productivity through taking a strengths-based approach. So the first is about that idea that really the public service reform approach we need is relational. It's different kinds of relationships where everybody can be more productive. So moving away from those brief transactions towards those collaborative relationships in which a network of people are able to create more together, and having the clarity of what those behaviours and relationships should look like wherever they're found. That enables individuals to contribute more themselves. That isn't about people being charged. It's not about people being exploited. It's recognising that already much more care and support is provided by families, whether that's parents in the special educational needs arena, or whether it's family carers providing more than the value of the NHS for adults who need support. But we don't recognise that, and we don't set up systems that enable that to happen, whether that's for individuals or for families and communities. So I mentioned on a previous slide that there are already 250,000 people directing their own support through direct payments and personal health budgets. So they are already taking a very different role and having much more, contributing much more, but also having much more control and choice around the support that they provide, in a different kind of relationship with the people supporting them. And then we need something that looks a very different kind of deal for family carers to enable them to provide the support that they provide, which is huge at the moment, but could be much bigger and much more sustainable if we offered them the kind of training, backup, networks, and emergency support that people would need in order to provide that support well. And there's a few examples of that where that we talk about in the paper. So, for instance, the liberated method, which Demos have drawn on in their recent report, comes from Gateshead, and is for those people who are often attract lots of labels around complexity and risk, and described as having severe multiple disadvantage. So people that have really complex and very unproductive relationships with lots of services that cost those services millions of pounds and make them very unhappy. And the approach that the liberated method approach, alternative to that, is again about a different kind of relationship. Somebody in your life who sticks with you, who acts more like a coach than a supporter, who is enabling and has that long-term productive relationship. I work for Empower, where we've developed approaches of this kind which demonstrate that you can make that link between starting with the very personal. So here is the work we do in children's social care, which is all about getting away from very binary, risk-focused conversations about a young person towards a much more holistic, rounded view of what's going on for that young person. Creating the opportunities for individual change, which is better for the young person and their family. It's always about moving people closer to home or back home, making much less use of some of those cripplingly expensive, but also very low outcome out-of-area services that are an increasing feature of some of our public services, and more use of foster care, family care, community-based care, and doing that in a way which has the consistency that you can then start to create change at the area level as well, and start to reshape what commissioning looks like, and really link that different model at the practice level to what happens and the sustainability of an area's public service system. So there is, often this perceived conflict that we've talked about between a kind of a rights approach and a productivity approach, and it comes down to, we think, that error that we talked about at the beginning of trying to impose a private sector model on public services, where productivity seems to be all about efficiency, churning people through a system as quickly and cheaply as possible, offering them as little as possible. And whereas a rights-based approach, all about empowerment and good lives. And what we're saying is actually, if you take a strengths-based approach, those two things become one and the same, because it's about the most productive, healthy relationships in which everybody has the opportunity to contribute to their own lives, recognizing that particularly for those people who have the longest and most complex public service journeys, nobody can create happiness for somebody else. We can enable people, we can provide the support they need, but actually we need to create that good life for ourselves in partnership with the services that we work with. And that if you do those things, you start to create a kind of what you might call co-productivity, this idea of productivity, which comes from the relationship between all of those individuals. So how can we scale those? And that's where we sort of end the paper by thinking about learn what we can learn from sectors which are further ahead in this, we think. So, we do think that adult social care has quite a lot to teach the NHS in this domain, and at the moment we're seeing lots of focus on the NHS, and yet again adult social care being kind of neglected somewhat. But actually some of those more social services are the ones where some of this has already been scaled and trialed. We're going to need new people doing different kinds of jobs, which means we're going to need a new set of skills so that people can take on more autonomous roles where they can be more led by the individuals and less constricted within those very tightly boundaried sort of brief transactional roles. That can only happen when you have new kinds of organizations that are set up with flatter structures, are more values-led, have more trust in the way that they recruit and support their workforces. And that can only happen if we move away from traditional procurement towards more collaborative commissioning and approaches like alliance contracting to actually scale those approaches. In a previous paper for New Local, Chris and I set out some of the features of doing that and what a kind of a strengths-based organization might look like, with that idea of strengths-based working, but also co-production with people at its heart. And I think the next step then is to think about, and perhaps this is where we kind of hand over to you, if this argument is convincing that actually we need to move from that kind of practice level to that organizational level to commissioning level, and really then, and sort of our message to government is we need strengths-based public service systems if we are going to fix the current public service productivity crisis. And back to Ben and Thea.
Thank you so much, Alex and Chris. That was great, very stimulating. I have lots of things I want to ask. But before we do that, I want to pass to Thea for some reflections and remarks. Just a quick reminder, if you have questions, please use the Q&A button, which is sort of below the speakers and has a question mark on it, and it says Q&A, and then we can filter the questions that way. But over to you, Thea. Thanks so much.
Thank you. And thank you, Alex and Chris. It was a real pleasure listening to your presentation. Indeed, I've had the opportunity to read your essay beforehand, so I've really enjoyed it. It was interesting, Chris, that on one of your slides, you put up Julia Unwin's work on the two lexicons. And if you could see my notes, my first note is Julia Unwin, the two lexicons of public service talk, really. And I talk quite a lot about the need to be within a relational space rather than the other rational space. Sometimes people think that the opposite of rational is an irrational space. It isn't. The opposite of a rational space is, of course, a relational space in public sector terms. And it feeds into that conversation about the language of productivity in itself. And the language of productivity has never got any clinician up in the morning or any social worker up in the morning. And that, of course, is one of the things that is deeply problematic about the way in which we conceptualize this and talk about it at the beginning. I should be clear. I believe absolutely, and the area that I've looked at the most is the NHS. The NHS does have a productivity problem. So I start from that basis. But my curiosity was, why are we having such unproductive conversations about the productivity problem? Because I think we genuinely are. And I came in my thinking to a view that at the root of the challenges we face, in some ways, whatever model we use, is that particularly for the NHS and for much of social services, we lack the psychological safety to allow us to have the conversations that we need to have. And that can sound very fluffy, but of course, I think for many, many people on this call, I would hope you're very familiar with the work of Amy Edmondson, who first wrote about psychological safety, which she described as the felt permission for candor, and the way in which that's been utilised across a very, very wide range of industries and indeed public services to understand the state that you need to be in to have the right conversations and to do the right thing. And as I started to look at this more, I became very convinced that one of the reasons, whatever the model is, that we don't have the conversations we need is because there isn't safety. There isn't safety at all levels, from leadership often in organisations to clinicians, from the Treasury to DHSC, from DHSC and NHS England. At all levels, the idea that we can speak openly, honestly, discuss everything that's going on is very, very often not there. And if you look in the private sector, they take psychological safety and productivity very seriously. I often use these examples because I find when I talk sometimes to public sector audiences, for example, chairs of organisations, they may be very wedded to input-output data and find it very hard to look more broadly. And so one of the pieces of work that I'm very taken by is a piece of work that Google did called Project Aristotle, where they looked at 180 of their teams across the world and started with the question, which of our teams are the most productive and why? And let's be clear, Google were not doing this in order to be nice to staff or be nice to clients. They were doing this in order to see who was most productive and who will make more money. Their analysis over a period of years, and Google collect an amazing amount of data on all of their employees, including for a period of time who you had lunch with and who you went for a walk with. It's very interesting. We won't look at sort of, privacy. And what they said was, looking at these 180 teams, was it wasn't the best engineer, it wasn't the best computer programmer, etc. It was, of course, the teams which probably will be very instinctively understood by people on this call. It was people who worked together with shared values. It's people who understood what the outcomes were they were aiming for. They understood what the inputs were they were expected to do. And most importantly, they felt psychologically safe. They felt able to talk about when things were going wrong. They felt able to talk about when things didn't seem right, where they themselves were not working at their best and they needed help. They had the ability to ask for that. The NHS in particular and local authorities are quite poor still at collecting the right information to understand productivity. We collect data science. We are poor at being ethnographers in our own organisation. And ethnographic data needs to be understood against data analysis. And when you put that together, you have the richness in which you can start the conversations that you need to start. I'm very taken by the use of anthropologists in business. If you want to look at some of the really interesting work, there's an anthropologist called Eleanor Briodi, who for many years worked with General Motors, again, on looking at productivity. So again, this is a car industry, and they used an anthropologist. They used an anthropologist to understand what was really, really going on at a grassroots level in their factories, to look at how they could become more productive. Just a side note, Eleanor Briodi's over time set up her own consultancy and was once approached, she's an American anthropologist, by a very big hospital group who said, please, could you come and work with us? We want to understand how we can make our hospitals more patient-centric. And they were like, Eleanor and her team were, isn't that what you do all the time? What do you mean you want your hospital to be more patient-centric? And they were like, no, we know we're not. So she said, all right, look, give me an afternoon. I'm going to come and hang out in the hospital because I don't really understand your question. Anyway, after, of course, half a day in a hospital, she went, oh, yeah, I get it. This is this is not good. I get what I need to do. So, final comment. Paul Krugman is a very well-known economist, and he once said about productivity isn't everything, but in the long run, it is almost everything. I've taken the liberty over several months now, maybe a year of writing and talking about productivity to say, I fundamentally believe that for organizations, culture isn't everything, but in the long run, it absolutely is almost everything. I'll stop now. I'm going to disappear off screen because it turns out that my cat, who's in the room, isn't interested in productivity and is throwing himself against the door with a desire to get out. I don't know why. I think it's fascinating, but there you go. He's quite rude. So I'm just going to do that and then I'll be right back. Okay. Sorry, Ben.
No, that's all right. Thanks there. Good luck with the cat, and always nice to finish on a Krugman quote. We can see lots of questions coming in, which is great. As a reminder, go to the Q&A function, not the chat function. Q&A function, and you can vote. It's very democratic here at Demos, so you can upvote the questions that you most want me to come to first. I'm just going to ask one quick question, and then we'll go to the Q&A. As a I think I'm probably persuaded public sector productivity is very important, but there are still some skeptics out there. And just whilst you guys were talking, I kind of got up a chart of public sector productivity in the UK. I can't find any data pre the late 90s. It might be that we only started collecting it then, I'm not sure. But public sector productivity has basically been flat. It looked like it went up a little bit, kind of post the onset of austerity. So and I know we only have data going back to the late 90s, but could we have a revolution in public sector productivity, or is it always just going to be a little bit flat and therefore is not a particularly useful concept? And that might be because productivity is just a unhelpful way of thinking about public services, which are quite different to economic productivity. What do people say to the skeptics? Chris, you came off mute first. I'm going to pin you down.
So we are suggesting that if the models and the approaches that we're talking about were put in place, and that we've seen this at a local level, productivity as measured using the kind of ONS methodology would improve, because essentially with the kind of resource that goes into public services, we could do much more. What we would be doing would be very different, but fundamentally we would achieve much more for people, for communities, and those things would ultimately be measurable. They would be measured in terms of people's ability to look after themselves in different settings, to take more control over, for instance, their education or their search for work, or their rehabilitation after, whether it's an injury or a rehabilitation in the criminal justice system meaning of the word. So it would ultimately lead to a better set of outcomes for people. And so therefore we do think that ultimately, yes, we would actually improve public service productivity in the way that it's measured. Obviously, we're not doing this in order to try and improve public service productivity in the way it's measured, because we want better services for better people, and people to be better. But I think that's where we're coming from, yes. And I think there are examples of that at a local level working, and it just needs to then, it's that ability to scale that's the challenge in some ways.
Thanks, Chris. Alex, did you want to add anything to that?
Yeah, I'd agree. And I mean, I was really stunned when I sort of started looking into this for the essay, just how poor and unconvincing the current measures of productivity are, and the big whole swathes of public sector productivity where the ONS essentially says we have to create a measure of it, but our measure is just inputs equals outputs, and we're just going to call that productivity because we can't do anything else. And by definition, that's not a measure of productivity. So when you look at that data that you're referring to, we've just got to recognise that some of the measures involved appear to be sort of almost nonsensical as far as I can see. No offence to the ONS, but and many and the rest are unconvincing in that they adjust for things like quality and kind of assume it's probably a proxy for productivity. And I'd say the reason they do that is because of that fundamental mismatch between how we normally measure productivity, which, as we say, in the private sector is relatively simple because you can put a cash value on stuff,
Yeah.
Going in and going out, and what we actually value in public services. And we've got to be able to bridge those two different perspectives in order to say something coherent. And for us, it's that good lives is essentially what we're all aiming for. And that comes from the behaviors and relationships, because 90% of what we do in across all public services is we put people together and they have a relationship with each other of some kind. That's what we do. We are in the people and relationships business if we're in public services.
Cool. So something about productivity is still important, but current measures aren't working and need to be changed. Yeah, cool. Thea, did you want to come in? I think you may have been dealing with the cat. No, all good. I'll go to the Q&A. Wow, 17. Look at this. Which seat has got the most upvotes? Rod wins that game. I'm going to read out Rod's question. I might do two actually, and then we'll go to panelists and you can kind of pick and choose. So Rod asks, I'm struck by the similarity between the concepts being talked about here and the concepts developed in systemic family therapy, concepts such as relational workings, safe conversations, and many more. So if anyone has anything to alight on that kind of comment. And I'm going to go to Grace's question, which is more of a question than a comment, which is great. Is moving to commissioning for outcomes a way to make strengths-based and relational approaches more tangible? Outcomes contracting can be a really effective way of increasing accountability for outcomes, as well as improve effectiveness and value and therefore productivity. So a sort of comment around systemic family therapy and the connections with the discussion we've had today and that agenda, and a question from Grace around commissioning for outcomes and whether that can help bring about a more strengths-based approach. Who wants to come in first on that?
I'm happy to go first.
Yeah, go on, Alex.
Very briefly, in terms of systemic family therapy, I think that if you look across a range of different areas of public service delivery, there are models and ideas lurking that resonate with what we're talking about. So I agree, systemic family therapy, I think there's some resonance with what we're talking about. I do some work in criminal justice. I think the desistance approach, which is very popular with practitioners, but sometimes people struggle to turn into practical ways of working, has a lot of resonance with the strengths-based model that we're talking about here. I think you could take other areas of public service and you would find resonance with the kind of the broad model. So I think what that tells me is that there's actually a lot of interest in a whole range of different areas of public service practice and amongst different public service professionals in these kind of models. And that's a really good asset that we can build on. In terms of outcomes, yes, I think that a move to outcomes-based commissioning can, but not necessarily will, support the kind of work we're interested in. We have some examples from research I've been involved in over the last few years, looking at some, reasonably enlightened outcomes-based commissioning models, where a move to outcomes-based commissioning was tied closely to a more strengths-based way of working and a systemic approach to thinking about how those services were then delivered across the system, and that led to improvements in productivity, better outcomes, and we've been playing around with some ways to measure and evaluate that, and using different methodologies to test that proposition. So I think it can do, but of course it doesn't always. Outcomes-based commissioning can, replicate and sort of reinforce some of the worst elements of the new public management model. So it's not a given that moving to outcomes-based contracting will automatically lead to better approaches, but it can do. And happy to point people to examples of where it has.
And I think defining outcomes becomes then really crucial, and then how you define them as well as what they are. So I mentioned alliance contracting approaches, which collaboratively define what good looks like, involving the people themselves as well as the commissioners and the providers, and have shared responsibility for success, tend towards that kind of approach. I think you do have to sort of mention the human learning systems critique of that, which for some people from that field would say, you can't. It's always gameable. It always gets gamed, and the process of trying to define and measure outcomes can be, or is almost inevitably part of the problem. And actually, what we really need is to define the behaviours, and the key behaviour being a learning organisation and embedding learning and innovation into organisations, which perhaps would sort of come back to some of Thea's psychological safety points as well. That it's a set of behaviours that create value, and you should collect lots of data about outcomes, but use it for innovation and change and learning, not for control. Is one of the interesting ideas in human learning systems.
Yeah, I would agree with both Alex and Chris. It can be a lever. I've been commissioned when I was running organisations. I've been commissioned under outcome-based commissioning. And I would agree with Alex, that can be a lever for change, but you have to have good relationships in place already. You have to have high levels of trust in place already. You have to have the right behaviours and culture in place already. Then it can leverage that sort of change. One of the things I think is really problematic in public services currently, and has been for many years as well, is the length of time that people are prepared to give to something to see whether it will work or not. So with outcome-based commissioning, where you're often, if it's good, looking at sort of really holistic outcome goals for individuals, you can't see and test whether or not everything's gone right in 12 weeks or 6 months or a year. And we work in very short cycles often, wanting to be able to evaluate if a model's worked. And I think that's a real challenge, because often they don't show the success very swiftly. So you need the relationships as well that are going to sustain over time.
Thanks, guys. Great answers. Some good questions. Moving through, wow, loads of questions now. All responded to my call, which is great. So question from Rachel. Is it possible to scale relational delivery to meet the scale of need there is for all types of services? How do you overcome potential limitations to a co-commission/productivity approach? E.g., is there enough interest and bandwidth from users to co-create across all types of services? How do you ensure good outcomes in the spirit of such an approach for people who do not have capacity for themselves or family support to do this? So a really good question there on, what's the potential for building these relational strengths-based public services across the full suite of public services. I will just take another one as well, so you guys can do a bit of picking and choosing. Actually, no, that's a meaty one. Let's just go straight into that, I think. Yeah. Anyone wanna jump in?
I'll give that a go.
Great, Alex, thanks.
There was lots in there. Thank you. So it has to be a choice, not a compulsion. So, but it's a choice that, given the right circumstances, many people will want to create. So I co-create, and providing that's well supported. It's so if we look at so one of the examples of that happening at scale already, I mentioned that between them, personal health budgets and direct payments have about 250,000 people co-creating, and in some cases completely directing their own care. So that's a pretty significant change. It's enabled people to do really creative things to really retain their control and dignity, because those services are often inevitably an intimate part of somebody's life. If you've got a service coming in providing intimate care, perhaps some people are running pretty much home hospitals. It creates incredible value sometimes, because the tailoring of that, the fact that people feel really responsible for that, and often find ways to do things much more effectively, sometimes much more cheaply than services in the past would have done in a sort of traditional off-the-shelf approach. There's all sorts of good things in there. There are also all sorts of pitfalls. So I've sort of been in councils where I felt that there are communities that the council doesn't really understand or have a great relationship with, and it has kind of sort of chucked direct payments at those communities because it's a way of providing a service for people, which actually the kind of the amount of sort of input and creativity and the support for people to use that really well, that resource really well, isn't necessarily there. So there's definitely a role for the state in doing that. In a previous paper, sort of Chris and I sort of think sort of imagining a future where you didn't necessarily have traditional public service organizations, but you definitely need that framework in which you're bringing those people who need support, those people who want to offer support together, and the equality and tackling inequalities is a really key part of that. So one of the pitfalls around direct payments has been that it's been much easier if you have lots of resources and you're really well educated and you're assertive and you're perhaps well connected in order to sort of really shape something well, and much less so for people that don't have any of those kinds of privileges. So you can end up exacerbating inequalities rather than tackling them. So I think that was sort of part of kind of Grace's question, you know, how do you kind of get equality in there and avoid this just becoming that kind of free market? And it has to have that kind of brokerage, guidance, navigation, connection kind of role to enable people, everybody to be able to use those approaches, even if they need lots of support to use them.
Cool. A great comprehensive answer there, Alex. Thanks. Did any of the other speakers want to come in on question of how we do relational across the board? Cool. Okay. I'm going to go back to the Q&A. We're getting quite a lot of questions with similar number of votes, so I'm going to be a bit dictatorial and just pick some which I like. Actually, no, there's one that is ahead of the others. So it's a question from Terry Dixon. This is a great question. It's quite a big question, so be prepared. Is there a deep underlying challenge in how people view the value/status of jobs on the front line? Our definitions of a successful career are driven by what the government defines as success for the country, stuff that drives GDP. How do we make a shift in the value we place on these roles and invisible, often unpaid community family support? Also, how do we measure that? That's a great question. I'm going to also take another one. Peter Leonard has asked a really interesting question. I'm wondering how this relational approach can stretch to whole communities and whether there is a sustainable way to do this. This is a little bit like the previous question, but I think it builds on it. A bit like a business flywheel, adding energy at one point to then give the flywheel, or in this case, the community, the momentum to keep going increasingly on its own. So a question from Peter around how do we kind of build and sustain momentum around relational approaches and relational change? And then a question from Terry about how do we change the value and worth that both public and governments put on frontline public service jobs. Does anyone want to try and pick off?
I think I think that question about value and worth is incredibly important. And I don't think there's any easy answer. We currently have, well, you know, if you just look at the health service, we have an obsession and a hierarchical view that hospitals and hospital jobs are more important than community jobs, that more important than social care jobs. There's really clear hierarchy that is both implicit, explicit, used in the way we pay people, used in the way we train people. It's even within medicine, the parity of esteem between a hospital consultant and a generalist consultant GP is not there. So it is a massive, massive shift. You can do it if the country that has seen the biggest shift in esteem and value and focus on jobs that are community-based, frontline. I'm not sure what they've done on unpaid carers, but I imagine they've done more is Denmark, and they have done some significant work in changing that culture. But that is a real 10-year plan that had real momentum and a huge amount of money put into it. To really bolster up those jobs and for people to see them as more important. You know, you do actually have to pay people more money. Quite a lot of the Scandinavian countries do that, for example, with teachers. Teachers get paid really, really well. Remarkably, who would have thought more people want to do the jobs and people think of them as more important? There you go.
Yes, quite. When you put it like that. Chris, you look like you want to come in.
Yeah, I mean, I suppose one of the things we've suggested in this paper and in a couple other places is that self-managing teams are part of the solution here, in the sense that that sort of democratization of roles within a team with a shared purpose. And I think this talks to the point Thea made when she was giving her remarks about, what makes effective groups of people, teams working together. So I think we think self-managing teams are a route to some of this, alongside, a different approach to recruiting and training people to work in public services, much more values-based approaches, both to recruitment and to then training and supporting people. So I think there are some sort of practical things that have been shown to work to some extent. None of them is a silver bullet, but I think they point in a general direction around a different way of valuing different experiences and a different way of people relating to each other and sharing the roles that need to be done in order to deliver great services.
I agree with both of those, and I think we do tend to, so particularly sort of like, again, thinking about adult social care, where there's a real issue around low status and low pay jobs. We do sometimes talk as if we could somehow just raise the pay, then and get people that would be more qualified, that would sort of raise the status. But actually, we've got to do that in parallel with redesigning the roles as well. So it's got to the redesign of the role and the redesign of the skills, and therefore the status and pay and terms and conditions have to go alongside each other. I started my career in frontline adult social care, and those roles can be quite constricted, quite narrow. Don't necessarily, there's lots of rewards in them, but are not framed in a way that enables people to really kind of give as much as they could. Equally, in order to do that, we need to be sure that we're recruiting people for all of those sets of skills and abilities that we've been talking about, that enable people to take on those very autonomous roles. And the shared lives example I mentioned before was one of the things that was interesting about that. Was that there was so much more invested in recruitment in terms of time and a very relational, getting to know people really deeply recruitment approach, which then enabled those people to take on a much more autonomous role than they would otherwise have done. So there was some real investment up front, but then huge savings down the line. On that communities point, and can we sort of take that relational approach? Could it stretch to whole communities? I think that's a great point. And, look at the work of people like Cormac Russell around asset-based community development. There's a great network, asset-based community development network, which kind of gets away from that idea that we've had in the past, particularly around things like big society, where either the state does it or we kind of leave communities to do it. And I personally, I think this may not be kind of traditional ABCD approach entirely, but I think we need that different kind of partnership where people and communities do get the kind of backup and support and resource, but in that enables them to do things with more freedom, and that relationship needs changing, I think, between local authorities and charities. And we certainly found that in that review of charities, for instance, and social enterprises, that people were putting incredible amounts of process and bureaucracy around really small amounts of resource. And that is just not a productive way to have a relationship with community groups that can do so much better. Leeds recently launched its neighbourhood health service, and if you look at their neighbourhood networks, Thea knows this really well. There's a really great example there of really sharing resource and responsibility and empowering communities in a very intentional way that appears to have had really great results.
Cool. More great answers to great questions. I'm going to take a couple more now. There's a really good question from Hannah Hessel-Greaves. What understanding about public value do we miss when we talk about productivity? When we are evaluating outcomes and trying to make them less vague, it often starts with leaders asking good questions about what's vogue and valuable, and not about throughput and efficiency. What, in your experience, are good alternative starting places? I'm going to follow that with another question, which is a bit shorter from an anonymous attendee, which is basically, we've been talking, I guess, quite a lot today about the limitations to current productivity metrics. So, basically, the anonymous attendee asks, how would you redesign productivity metrics to better account for strengths-based approaches? Is it possible to quantify? So, yeah, I guess we've been skirting around the question of current measures seem to have their limits, but what might some new measures look like? And Hannah's question was about what's a good kind of alternative place to start when we start talking about productivity. So does anyone want to come in on either of those questions, Hannah's or the anonymous attendee's question about alternative measures and where we might begin to change and reform how we measure productivity today?
I'd be happy to have a crack at Hannah's. And I think it also relates to the question that Mark Smith's asked as well. So, I mean, I absolutely agree, Hannah. And yeah, I mean, one of the challenges here is how helpful it is to frame all of this in terms of productivity. I think we need to, though, because it feels as though there's a lot of great work going on at a local level, but ultimately we've got to find ways to escalate this up the political agenda. And ultimately, if we can't engage officials in Treasury, Cabinet Office, etc., around these kind of issues, it's very hard. So therefore, to some extent, we have to talk in terms of the language of productivity, etc. I think the answer, though, in terms of the starting point, is we very much see a strengths-based approach as being the flip side of good co-creation. So we very much see those as two sides of the same coin. And sort of the model that Alex put up on our last slide, the garish pink model, is kind of, very much sees that as the starting point, building long-term trusting relationships between people who are involved in service delivery and people who are using services that are co-created all the way through, and then that reflecting in the way in which the organization itself is structured. And that's the starting point for asking the good questions, the right questions. So that would be my answer there. And I think that then also to some extent answers Mark's question possibly as well, which is that, essentially, if you start from that point, yes, you don't have a conversation about productivity, you have a conversation about a better life, a good life, and what that looks like for people, for groups of people, for communities. And that's obviously the best starting point, because that is a motivating, empowering conversation, both for people who are involved in service delivery and the people who are making use of the services. And therefore, you start from a different position.
I think I would agree with what Chris said. I think there is also something, because we're probably, we're not going to change the world. The world will not revolutionize, unfortunately, despite the brilliance of the essay that Chris and Alex have just written. I would predict the world is not going to suddenly, or even in the midterm, completely change, which is sad, but it won't. And so I think one of the things for me as well is how you deal with the KPIs you've already got, but you become creative and thoughtful underneath them. You become creative and thoughtful when you recognize that people are still going to look at how many contacts does a community nurse have in a week? How many contacts? Obviously, health services is the thing I know about the most. And actually, the ability to have the conversation around that, it's not necessarily a wrong question from the point of view of the NHS. How many contacts does that community nurse have in a week? And why are they having so many fewer than they're having in Wigan? The question is remaining curious and not stopping at that first level of question. And I think for me, there's something about how we can leverage change in the system that says that question about how many community nurses is that being seen by that nurse in Leeds, Wigan, Bolton and Marylebone needs to be the question that's only the top level question. What then are the and why and how and what did the patients feel and how many were then no longer in receipt of services and how many people felt comfortable and etc. etc. There is the level of curiosity. The thing that's so wrong at the moment and so broken is that we start at that top level and we believe it tells us something. something absolute, whereas what that tells us is something very partial that should lead us into a range of other curious questions. I do like the idea of self-directed teams. I think the Buurtzorg models from the Netherlands have been really good examples of how they can have really good impact. And learning from those examples, I think, also helps us.
Thank you, guys. More great answers. So many good questions here. I'm going to go to a controversial one. Well, I think it's controversial. From Matthew Horn. It's provocative, maybe not controversial. Can relational approaches reduce, in big letters, capital letters, productivity in the short term based on current metrics? It involves reducing caseloads for social workers, clinicians, therapists, probation officers, offender managers, etc., and doing more intensive long-term work with people that yields better outcomes in the long term, but not in the short term. So controversial one there from
It's
Matt.
actually sorry, I got over enthusiastic there.
Yeah,
He's completely right. And
yeah.
but that's exactly what the Buurtzorg model is. The Buurtzorg model is a model of intensive community nursing using
Mm,
very highly skilled professionals who work one-to-one with much, much smaller caseloads than
mm,
you get for any caseloads for community nursing over here.
mm,
So on the metrics initially, you have a huge reduction in productivity.
mm.
And over time, lo and behold, it's a lot better. So I'll let the others come in, but
No,
yes.
no, that's undoubtedly true. I think the only thing I caution against is that sometimes we assume that the gains from this are all really long term, and actually our experience is that some of the gains from that's absolutely true. You know, if you particularly in models which require a deeper relationship, therefore you see fewer people. Therefore, on that measure of productivity, which of course we're sort of challenging as to whether that's the right measure or not, but on that measure that reduces. But then also in some of these examples, some positive and cost saving things happen really quite quickly. So when you start to develop a better relationship and understanding of somebody who's currently getting really complex care. So in my current work, we're quite often kind of coming across people, adults and children, that have ridiculously high staff ratios in their support because they've got lots of risk factors attached to them. So, you know, people I think 7-to-1 staff ratios is the highest I've heard. How do you even fit everybody in the room? Those are not creating kind of value for that individual. They're costing an enormous amount, and through moving towards a picture of what's really going on for this person, what does life look like, what would good support look like, sometimes you can in the short term make some pretty dramatic some changes that might reflect a difference between some of the health and social care where a lot of social care is commissioned or procured from an independent provider. If you've got independent providers, as we have in some parts of the world, which are charging a lot for doing stuff that isn't very good, politically you can reduce that cost. If this is an in-house service or it's a service like a hospital where actually you've got an employed workforce, and reducing cost is a very different kind of question, and that looks quite different. But it isn't always a really long-term change would be my kind of point there. But the underlying thing is that it's those measures of productivity. How many people are you seeing? It's absolutely relevant. How many people are you having an interaction with? If you do great stuff, but for one person, that's usually not kind of justifiable. But actually, if the interactions themselves may tell us nothing about the productivity in terms of the value being created in the system. And actually, coming back to Mark Smith's work and Gateshead, so I believe sometimes some of that support did almost involve one-to-one ratios, but the person before may not have had that huge ratio support, who was in one of those people that was living a very chaotic life, perhaps interacting with lots of services. They were getting support in some ways, or they're interacting with dozens and dozens of services at huge cost. So actually, in that instance, you place that with one really good relationship. You know, that could be a productivity gain rather than loss, I'd argue.
And just to give another example outside of adult sort of social care, etc., did some work a few years ago looking at the implementation of strengths-based models in criminal justice and probation services. And one of the early gains there was that using a genuinely strengths-based way of working, co-producing with people, led almost immediately, in some cases, to a complete reassessment of someone's risk. So because the system was using a very standardized criminogenic risk model that tended to lead to people being classified in quite narrow categories and then people being recalled to prison quite quickly if risks moved. Once you moved to a relational way of working, you very quickly got a different understanding of risk because you were looking at the person holistically and you were actually listening and talking. So, the initial meetings and interaction with that person were longer, so more response was needed. But very quickly, you then had a different understanding of risk, and then where someone might end up being recalled to prison, which is a very expensive outcome, very quickly, they were then sustained in the community. So there's, this works in other sectors as well beyond sort of health and social care.
Thank you. We have got 2 minutes, which I don't think is quite enough time to go and take some more questions. So I'll be asking you to speak at light speed and response. So unless any of the other panelists want to add anything to what they've said, I'm going to bring the discussion to a close. Thank you so much for everyone's very active participation. Great voting on questions, great submitting of questions. Sorry we didn't get through all of them, but I hope you feel that we've reflected what the audience wanted to discuss. Alex and Chris's great essay is on Demos website, demos.co.uk. Now, if you want to go and read it, I'm sure we can put it in the chat as well. And yeah, stay tuned for more events like this. As I said, Demos hosts these every month, so I hope to see you at another one. We actually got one 27th of November, hybrid event in London and online, looking at technology and how technology can support a liberated public sector workforce. So continuing the conversation there. Thanks to our speakers. Thanks a lot to everyone for their great questions, and hope you have a good rest of the day. Cheers, guys. Bye.